Oncology, lifetime cumulative dosing documentation workflow. When looking at a patient who is currently on a treatment that contains a medication which has a lifetime cumulative maximum dose, there are a few places in the chart that we can go to help ourselves to see how much of that drug the patient has had administered. One of those areas is from the Oncology tab on the table of contents under the flow sheet. Here we can see this patient has had doxorubicin and the required administration dose is at 20 milligrams per meter squared. Thus far, they have had nearly 20 milligrams per meter squared for one dose. As this were to be administered over time, you could see how many milligrams per meter squared that patient has had. Within the system, there is also another way. When looking from the table of contents under orders, a clinician can access options from the toolbar and select Add Lifetime Cumulative Drug Administration. Once this is selected, another window pops up. The clinician must select the drug under question. So in this example, we're going to look at doxorubicin. Within this window, there is an upper and a lower portion. The lower portion here with administrations refers to those that have been administered within the VPP or otherwise a Cerner site. The upper portion shows outside administrations, and these are entered manually. The first question would be, has the patient received an administration of this drug outside of Cerner or prior to Cerner being implemented if this was not part of the backfill or the cutover process? If they had, the clinician would have to input the required fields under outside administration. One thing to note is that the total milligrams displayed in this calculator is in milligrams and not milligrams per meter squared, which is required to see if the lifetime max has been reached. When filling in this outside administration, as a useful tool, something to add in the comments might be what the milligrams per meter squared were. For example, let's say this patient had 36 milligrams at an outside facility, and this was milligrams, not units. And for this administration, the patient had weighed, the patient's weight was 70 kilos and they were 170 centimeters. I could backdate which date it was that the patient had this dose and fill in who the physician is that they are under at the site. As this will reflect only the milligrams, I may want to add in the comments what the milligrams per meter squared was used at that time to calculate this dose. And add it. Once I click add, this dose will be added to the upper portion of this window to show and reflect that the patient had this dose delivered on March 4th at an outside center at 20 milligrams per meter squared. Now, another function of this, so does policy require the anthracycline cumulative dose calculation to be documented as well? If that is a part of policy, you would go into your interactive view and I&O and select the lifetime cumulative dosing documentation band. Within this band, you can see that the anthracycline cumulative dose is in blue text, meaning that there is some reference text available. If you click on the reference text, it opens up the window giving you more information on the conversion of calculation for the specific drugs. So doxorubicin, for instance, is a 1-to-1 ratio. If we had administered the 20 milligrams per meter squared, I would simply come into this window and transcribe 20 milligrams as the milligrams per meter squared that I was administering to my patient and click sign. Once documentation was complete, the question would be, does the ordered dose fall within the lifetime maximum range? If it did, I would continue on to the oncology medication verification and administration workflow. If the range was above, I would then continue on to the oncology treatment parameters not met workflow. This concludes the functionality and workflow process of the lifetime cumulative dosing documentation.